So I have a very curious question. As a lot of people, a lot of women especially hesitate to seek hormone replacement therapy. I think it's a good number of research and literature out there regarding association of that to cancer. Do you get a lot of those questions?
I do.
How do we bust those myths so more women are comfortable coming to health?
Yeah, so I think ultimately it boils down to making sure that we are doing all of our preventative services, right? We know who we can't treat with hormone replacement. We know that if you've had breast cancer or have a high risk of it in your family, especially hormone driven breast cancer, then no, these are not the meds for you. However, this doesn't mean we can't help you.
Right.
We have a lot of different treatments that are not hormone based that could provide benefit to women who are in those certain situations.
Yeah.
In terms of making sure that we are keeping people safe while using hormone replacement, it's very imperative that we're not ever using like estrogen by itself, right? We have to balance that out with progesterone.
Right.
And we have to make sure that you're doing your annual mammograms, your annual PAPs,
Right.
all the things we do anyways. But we just
Yeah.
make sure that women are okay with and in agreement with pursuing that while they're doing therapy with us.
For sure.
Yeah.
I mean, we many of us, including myself, struggling for so many years with PMDD. So you have those few days before your period, and it's all like weepy, angry, mood shifting, and then you get your period, and then you're back to normal. What do you advise women who are having these issues, or premenopausal women too, who might have trouble sleeping? Like for me, for example, I got the Somorelin. Am I saying it right?
Yep.
And honestly, it's been life changing.
Yeah.
Night sweats are minimal. I can sleep through the night. There's a woman out there right now who might be experiencing the hot flashes, the mood shifting, the dryness, the what do you say to people like that who maybe might be still having the fear or hesitation to come in and seek the services so their lives are like literally changed like mine did?
Yeah, I mean, I would say, why hesitate? I mean, and I always ask myself, anytime I'm hemming and hawing over doing something, what's the worst that's going to happen?
Right.
Okay, so you're not, losing anything by coming here and talking, right? You're going to come in, we'll check your lab work, talk to you, make a plan. Doesn't mean you have to do that plan.
True.
But I also want to be very clear in that I'm making plans that are safe for people. We're not going to do something that is unsafe for you based on past medical history, based on goals, based on lifestyle coming up, so I'd say, why wait? Come in, at least get it checked out. It doesn't mean you have to do it.
Right. At least you get an idea.
Yeah, you can get an idea. You can get like some sort of like direction as to what you want to pursue. And, I think that a lot of the hesitation with hormone replacement, both men and women alike, is that, unless you eat, sleep, and breathe it every day, it's different. It's challenging. It's not something that's done easily in primary care.
Right.
With the 15-minute visits. It just there's no way around it. So
there's no way around it. There's no time,
There's no
and there's no
time.
addressing it, or just providers in primary care are uncomfortable to go there.
Exactly.
And, for OBGYN, they want to do their regular yearly checkups on you and you're out the door, or you're offered antidepressants as a way to manage the PMDD, which I've heard time and again from my clients. It doesn't do anything, and then it comes in with those side effects as well. So
yeah, and I do think the FDA has recommended as a treatment line approach for PMDD SSRIs, right?
Yeah.
But at the end of the day, it is a hormonal shift that's causing it. And so if we can take care of that for you, even if it's in the brief period leading up to your premenstrual cycle and depending on where you're at in life, then I think that's the safer route to go.
Yeah, that's no brainer.
Yeah.
Absolutely. One more question I have for you, Krista, is the landscape of this treatment. Do they have different versions? I know a lot of clinics will throw the injectables, but I realize they have pellet versions, they have patches, they have tablets, and also can touch up a little bit on the cortisol level checks. Because that you sold me on that.
Sure.
Like, I need to know how much stress this body is taking on every day. So
Yeah.
tell us a little bit about that because that's a really
Yeah.
exciting service.
Okay. So in terms of replacement, we have many different avenues. We can do injectables, which a lot of times we do use because they are a little bit more bioavailable. In terms of women's hormone replacement, a lot of times we use capsules. So capsules and or cream.
Right.
For peptides and weight loss medications, the best effect is injectable.
Yeah.
It just is what it is.
Yeah.
There's really no way around it,
Yeah.
unfortunately.
Right.
But I can say that I've had numerous clients who are afraid of needles who are
Mm.
not anymore because they feel so good. They're like, no, I'm not
Exactly.
stopping this. So,
Yes. Like wearing high
um,
heels, right?
yeah, exactly.
Feel a little pinch. Right. It
In
looks
terms
good.
of like cortisol testing, it is saliva based what we do, and it's very specific. So you go home with a little kit that has 4 tubes in it, tells you what you can eat, what you can drink, what you can't eat or drink, or meds you can't take before it leading up to it.
Yeah.
You ship it in. It does take a while to get the results back, maybe around 2 weeks to get them back in. And then, I kind of look them over and interpret them. And then a lot of times, and I think I touched on this a little earlier, but just a lot of the treatment for cortisol is lifestyle management,
Yeah. Oh my gosh.
lifestyle and supplements.
Yeah.
So,
Lifestyle management. Oh my God. I love that so much.
yeah,
The fact is, lifestyle changes management. It's easy when you start, like, especially first week of the year,
right.
January 1st, but the maintaining
Yeah.
of it. And so, how do you support your client besides? I love the fact that, do you have that direct access? Like, for me, for example, like, I'm not the kind of client that will be a nightmare texting
Yeah,
at
no.
7 p.m. on Friday night, like, hey, Chris. But not like that. Having those boundaries, I think, is also very important with
Sure.
clients. But how do you manage all this stuff? What was I going with that?
Like the lifestyle
The lifestyle
modifications.
modification.
Yeah.
That's what I was like. How do you manage all of that for client? Like, what's some? Do you refer them to like nutritionist? Um, I know gym. It's like it has to be somebody's desire, motivation
Right.
to do. So don't fall off the wagon because just the meds alone isn't enough. Doesn't suffice.
Yeah,
And
no,
how do
you're
you
right.
work around most of those patients to keep them going for the
Yeah.
long term?
So you're so right. It can't be just a medication approach. I mean,
Yeah,
it is very, very comprehensive. And so,
absolutely.
I do have a lot of clients, especially with like the weight loss meds, come in and they're upset they're not losing, and it's
Yeah,
a constant conversation, right? So if we
right.
need nutritional support, I do try to provide it myself right now.
I
I
love
can
that.
refer out. So I will make my diet plans. I can do
Yeah,
that in
that's
addition to the
also
services offered. And currently, I'll put together small workout programs for people if they want it. A lot of times, people do come in with like a general idea of what they want to do.
yeah, yeah, yeah.
I think the most challenging is to try to help people figure out when they're going to fit in that exercise, and stuff like that. But one of the goals for this coming year is to get a personal trainer in here. To start
So
making some plans for people and potentially helping
yeah.
support them in that aspect.
That would be so amazing.
Yeah.
It's so hard to find personal trainers.
Yeah.
The big gyms, they might have to offer it, but sometimes part of memberships, like you get 1 or 2 times a year.
Yeah.
Otherwise, you're, paying a lot of money to keep them on a weekly basis. So that will be
Right.
so comprehensive and amazing to
Yeah.
come here and have all the parts of you taken care of in
Yeah.
that way. Um, so yeah, as we ease towards the ending of our session today. How can people find you? Are you online? How do we track you
Yep.
down?
Yeah. So I'm online. I have a website, magnolia-medaesthetics.com.
Love that name.
Thank you. I also have a YouTube channel at Living Well with Krista, and same handle on Instagram.
Okay.
And I do have the business pages as
Yeah.
well on there, Magnolia Medical Wellness.
Yeah.
So,
Oh, I love
yeah,
that. And you have membership services, and
I
then
do.
people can pay as they go as well.
Yeah, yeah. So a lot of our peptides right now are based on a 12 to 24 week program,
Hmm.
depending on, what what the goal is.
Yeah.
We do have monthly memberships available for weight loss, men's health, women's health, and the ability to roll them together if we need to.
Yeah.
So,
Curious last question, I
yeah.
think a bonus one. What was your drive to include men? Because it's I have a good number of men in my practice. A lot of men feel intimidated or maybe even shy or the stigma to seek help for different things like that. What was your story behind that? 'Cause
Yes.
that's
So
amazing.
I just think that men suffer. I think women suffer in silence, but I think men do as well. And I
So
think for different reasons, right?
yeah.
I think that there is this stigma attached to TRT, as I mentioned before, that it's always, a sexual issue, and it's really not. And I have a very big relationship with the police departments locally and fire and military, and those type of jobs really require a lot of stress and sacrifice, and tends to be it eventually trickles down into hormone abnormalities. And so finding a way to support those communities, and our first responders that do so much for us, I think was a big motivating factor.
That's really
Yeah.
amazing because they will all need that
Yeah.
support and that access and making it easier for them to access those services. I think it's amazing.
Yeah.
Do you also do ED treatment at all,
I
or
do.
does
I
it
mean,
tie in?
it ties in.
Yeah,
Yeah, absolutely. It
yeah.
definitely ties in.
I have a good number.
Yeah.
Let me send you away.
Yeah.
Oh, this has been such an amazing discussion, and would love to connect with you again to
Absolutely.
see what else you're doing. I see you have like some aesthetic stuff
I
there
know.
as
Yeah.
well. Explore that in our next
Yep.
one. This has been amazing, Krista. I really appreciate your time and all
Yeah.
you do for our communities. And my life has been not being the same since connecting with you,
I'm
and I love
glad.
it so much. And here we are.
Yep.
So, guys, check out Mongolia Wellness right here in Enfield, Connecticut. If you're checking us out from a different state or wherever, I'm sure
Hopefully soon
she
to be telehealth licensed in multiple states. So yeah,
that would be
but
so
currently I can
cool.
serve Massachusetts and Connecticut.
Ooh,
Yeah.
guys, you hear that?
Yeah.
So look out, follow her for more, and follow us as well. Subscribe, like, hit that like button, and let's keep these conversations going forward as part of our everyday conversations at our dinner table. Okay, bye. Love
Yeah.
you.
Bye.